Why are you blowing away all the leaves? Just leave them. Leave them. Ah. Welcome to another Health Chat. And today, Alex and I, well, mostly Alex, will give you 5 things your club can do to be more inclusive. But before we do that, Alex, why is it so important that clubs are inclusive?
It's important for clubs to be inclusive for 2 reasons. One, because it's the right thing to do. For many clubs, part of your mission and vision is to create spaces that are welcoming and accommodating for people of all walks of life, all ages, all abilities. But many people still struggle to fit in and feel confident in a health club. So taking these steps to make the club more inclusive can help make it more welcoming for all types of people. And second, it's really important from a business perspective. There's a lot more people out there with chronic disease or living with a disability or obesity than you might think. Consider a couple of statistics. According to the World Health Organization, over 1 billion people, or 15% of our planet's population, are living with some type of disability. In the US, over 20% of people under 65 and 37% of people over 65 live with a disability.
The WHO estimates that chronic diseases cause 70% of global deaths each year.
In 2014, the Partnership to Fight Chronic Disease predicted that 60% of Americans had one chronic disease and 42% had more than one. By 2020, that number is projected to grow to an estimated 160 million, with 83 million people having multiple conditions.
And according to the U.S. Social Security Administration, 1 in 4 of today's 20-year-olds are likely to experience some kind of disability in their lifetime.
Now, of course, as a club owner, you can't control everything, but there are a couple of steps that you can take to make your gym and your space more inclusive. The first is to make sure that the space is accommodating to a wide variety of needs and abilities. In the U.S., clubs must abide by the Americans with Disabilities Act, legislation passed to make places more accessible for people living with disabilities. This includes things like ramps, wheelchair accessible locker rooms and bathrooms, or pool accommodations. However, to be truly inclusive, we should think about meeting more than the minimum requirements. And when we talk about inclusivity, we mean arranging and designing spaces so that they're accessible by as many people as possible without accommodations. To start, consider how easy it is for someone who is using a wheelchair or a walking aid like crutches or a walker, or someone with a visual or hearing impairment to navigate the spaces in your club. ADA guidelines require a minimum clear floor space of 30 by 48 inches adjacent to one of each type of equipment. So, for example, one treadmill, at least one cycle needs to have that much space next to it so it can be accessed by everyone. Other things like text, contrasting colors, graphics, and braille can also make the club more accessible by more people. Think about how a lot of machines in your club already have pictures of people exercising correctly on that machine. That's a really good example of using graphics to make the thing more accessible. It's also important to consider other spaces in your club, like the locker room and the offices, and make sure that they also have the space and accessibility we've just talked about. It's also important to think about policies. For example, does your club have a policy around allowing someone's caregiver or helper to come to the club with them and help them use the club, because some people will require that help? How much does the club charge that person, if they charge them at all? When is it determined that that person's unable to come to the club? So these are all things that, if those policies are in place, it's easier for you to navigate this when you have someone come in who needs it. There's a lot you can do with what you already have. In fact, the point of inclusion is not to create separate programs and services and areas for people living with disability or chronic disease, but rather to facilitate their integration into the club so that they're in classes and spaces with everyone.
2, offer a wide variety of group classes.
It's good practice for any club to offer a wide variety of classes to appeal to a wide variety of people. But it's also a good idea to think about how you could adapt those classes. For example, clubs that offer special programming for older adults often offer classes that focus on balance and core strength and maybe fall prevention, things like restorative yoga or chair yoga. Clubs who ran the first round of IHRSA Foundation Access Health Inclusive Fitness pilot programs offered one-on-one small group training and classes to people living with Parkinson's disease, MS, autism, cerebral palsy, and visual impairment. You can also think about offering classes that can be modified for different abilities. For example, think about a circuit class that could be completed seated, or a spinning class that could be done on an arm-powered ergometer. Or are there any classes that are easy for someone with a hearing impairment or intellectual disability to follow along? Ultimately, what classes you target will depend on the population that you're looking to attract. So number 3 is institute a mission-driven focus on inclusivity from CEO to front desk staff. As you well know, your staff is the face of member interactions. And with any program or new initiative, staff buy-in is really important to the success of that program or initiative. And when your staff understands why you're doing what you're doing and is comfortable interacting with a diverse group of people, you can begin to establish a more welcoming and inclusive space. So make sure your staff knows what you're doing and why you're doing it and really buys into what you're doing. An important part of training staff is really helping them understand the proper terminology. For example, in the UK, often people with disabilities are referred to as disabled persons, whereas in the US, it's person with a disability. If you're looking for some early resources, you could go online to support groups and organizations that focus on that particular disability or chronic disease and see how they refer to themselves. But really what you want to do is use person-first language. So when someone comes into your club, listen to how they refer to themselves and their disability or chronic disease or challenge or mobility needs, and use the language that they use.
Number 4 is use images that represent everyone. Alex and I work a lot with stock images, and we know how hard it can be to find that perfect image to represent your marketing campaign and your business, especially when there are so many goofy images out there. I mean, think person in workout gear throwing shade at junk food. So check out stock image sites that take these tropes into consideration and really show how unique and diverse we all are. A few free sites you might consider are things like Unsplash or Burst, and there are also some really good paid sites out there like Body Positive Fitness and Graphic Stock. And these are only a few of the options out there.
And don't forget that clubs can also photograph their members to use in marketing campaigns or for graphics. Just make sure you obtain permissions from those members as required by the laws in your state. And this is also a really great way to build community in your club. And finally, number 5 is offer special programming for special populations. I know we talked earlier about how it's important to be inclusive and how that means facilitating full integration into the club, but offering specific programs for people with conditions like autism or cerebral palsy or visual impairment, for example, can be a good way to welcome people to physical activity in a safe, supportive environment. Earlier, I mentioned the Access Health Inclusive Fitness pilot programs run in clubs. Those programs are based on the Universal Fitness Innovation and Transformation model. UFIT is a global social change movement aimed to increase fitness opportunities for people living with disabilities. UFIT was developed by the UNESCO Chair in Inclusive PE, Sport, Fitness and Recreation at IHRSA in partnership with the European Observatory of Sports Employment, Universities of Spain and the Czech Republic, Skills Active UK, and IHRSA. Clubs interested in implementing structural changes to make their club more inclusive should visit justdoufit.com to learn more about what UFIT can offer. And clubs interested in learning more about the IHRSA Foundation pilot programs should email me. Opening your doors to people with disabilities, chronic disease, and obesity can help you not only bring in more diverse business, but also enhance your relationships in the community and ultimately improve the health of members in your community. These 5 steps we discussed will help you create a more welcoming and inclusive space for people of all ages and abilities.
Thanks for joining us. And if your club has a great inclusive program or resource, we want to know. Tell us in the comment section of this video. And be sure to like and share it to help spread the word on inclusive fitness. And if you want more content like this, be sure to subscribe to Alex's newsletter, the Health Benefits of Exercise Report. And you can also follow her on Twitter at IHRSA Get Active, as well as IHRSA's advocacy efforts at IHRSA_advocate.